181 already discussed question. This is related to firearm. So I have talked about singeing, already discussed singeing, blackening, tattooing. Singeing goes up to about 15 to 30 centimeter max. That is within about a fit distance. Very rarely. Blackening 40-45 is 1 to 1.5 feet distance, and tattooing is the range hardly covering up to like 60. There is about 2 feet. That's an average one. So if you look at singeing, blackening, tattooing are seen between the victim and the firing. So distance is basically maximum of this much only. So that is at a distance covered of about 2 feet. So that would be answer C. 181. The different findings related to the firearm should be displayed. Next question, something like a general knowledge rather. Right to Information Act, RTI, very popular in present India, was passed in the Congress regime around 2005, giving individual of the Indian citizens right to information. Act, RTI. So the RTI officer has to give information on the request of the individual sort of citizens of the country. So nothing much on discussion here. So that is 181. 183. 83. Record of body temperature. So this is related to already discussed point, cooling of body, which will help in estimation of time since death, and the recording of temperature of dead body is recorded by inserting a thermometer into rectum. This is the ideal place. About say 2 inches length inserted into the rectum and record the temperature and use for estimation of time. Already I have mentioned the curve of cooling is something called sigmoid. Initially not much of a change, then fall like this. And it cannot directly reach the external atmospheric temperature because of the bacterial activity and enzyme activity. So it's not going to touch the outside temperature very easily. So it is about cooling. Base right 184. And 184 is the next question. Saturnism. It's derived from the planet Saturn. In all Greek, Saturn was the sort of god of cultivations and sort of plantation rather. And people in the Greek thought that the planet Saturn was made up of lead. So Saturnism is chronic lead poison. It's nothing but the other name of chronic lead poisoning, also known as very popular lung disease. So that's just a sort of a different name for chronic lead poisoning lung disease. Then question number 185. criminal abortion techniques. Now, one of the techniques used is insertion of an abortion stick. Abortion stick is even something like we use calotropis or any irritant sort of a stick inserted to the uterus to initiate uterine contraction and subsequent expulsion of the product of conception. So that's the crude method of termination of abortion. Remember, IPC related to punishment of criminal abortion, 312, 313, 314, 315, 316. So 5 sections of IPC related to punishment of criminal abortion. Not going into details on that, but important all question. 185. Next is 186. Power of amnesty. That is pardon of a death sentence rests on the highest position of our executive, that is President of India. He can stop any punishment, commit death sentence, reduce any punishment. So he is the highest authority as per our Indian Constitution, and he can pardon death, commit death sentence, and give amnesty for those serious crimes. 186. Then 187. This one I have already mentioned in our previous discussion of aconite. Alternate contraction and dilatation of pupil. Initially, in the case of aconite, already I have mentioned, is a cardiac poison. Main action, hypotension, AV block. So pupil finding, one of the most specific indication of aconite, the unique hippus. So it's 187. Next, question number 188. Which of the following is not aryl phosphate? So OP compounds are classified into alkyl and aryl. Aryl phosphate. So here you have ACTP, EPP, OMPA, octamethyl, and something like malathion. So this is this side. And aryl, you have the other names like TIC20, parathion. So this is a sub-classification of alkyl and aryl phosphate, OP compounds. Mechanism of action I have already mentioned. Inhibit irreversible inhibition of acetylcholine esterase enzyme, leading to accumulation of acetylcholine in different synapses. So that is the main question related to 188. 189. Question number. Tandem bullet. Two bullets at tandem. Tandem means one after another. So what actually happened is, in the tandem bullet, a bullet is stuck inside the barrel. This is the stuck because of some, like unused weapon or sort of dirty sort of thing. Then this is the first bullet. Then the second bullet fire will push the first one, so they will travel one after another. So that is tandem bullet. So So that is related to some unknown event, like say a single entry, then it may come out as a double exit. A single entry, double exit, or while doing surgery, doctor recover a single entry wound, but two bullets inside the wound. So that's something need to be solved by tandem. 190. That's another picture question. A repeat question on postmortem staining. Cherry red, especially related to carbon monoxide poisoning. So that's a image question. So nothing much. We have talked about say a lot on PM staining, about 3 to 4 questions on that. So that's the importance of PM staining. 190 question. Let's come to 191. Stomach was for phenol poisoning. Phenol, that is carbolic acid. And when you read about acid poisoning, that is corrosives, gastric lavage or gastric lavage is contraindicated. Is contraindicated. But carbolic acid, we can use gastric lavage because it produces a thickened, leathery stomach. Stomach wall is thickened. That's why we can do gastric lavage. And when you do gastric lavage of phenol, one of the important things, there is 10% glycerin. Then other castor oil, olive oil, they can also be used. But question here, 10% glycerin. So first of all, carbolic acid, we can use gastric lavage because there is no fear of perforation and a specific sort of chemical. So that is 191. And we have 192. Question is on mushroom poison. It's interesting to note like about 95% of the mushroom are not poisonous. Only about 5% in nature. And of the poisonous category, most like Phyllodes is the most dangerous one, for which no antidote. But something like Amanita muscaria, we have specific antidote, that is atropine. Atropine is a specific antidote because it has muscarine-like effect, which is similar to opioid poison. So this is similar to opioid poison. So this is the most dangerous, for which we don't have antidote, and this one is something less common but has certain antidote. So that is atropine. 192, atropine poison, muscarine. Now let's come to 193. That is poisoning by mercury. Mercury known to produce renal failure by acting on proximal convoluted tube, PCT necrosis. Proximal convoluted tube. Now, other important manifestation of mercury poisoning include like chronic mercury poisoning produce tremor, most common form of presentation in chronic mercury poisoning, and treatment. And another important one is mercurial erytheism. That is neuropsychiatric manifestation. Okay. Treatment, mercury, normally chronic British anti-leucine, penicillam. These are the related questions. So that is 193 related to chronic, the effect of mercury on renal tubules. Then next one is another heavy metal, that is lead poisoning. We have talked about disease known as plumbism, also known as saturnism, and very important lead line on the gum is known as Burtonian line. Very specific finding. Even though this can be seen in other heavy metals poison, but this is Burtonian line is specific for chronic lead poison. That is 194. So few questions left. 195 is another question on solvent, sort of petroleum distillate poisoning, kerosene poisoning. In kerosene poisoning, there is a complication of chemical pneumonitis. So there is obviously a very dangerous threat to the life, especially common among the children. But this chemical pneumonitis developed, then there is a subsequent X-ray changes. So the words like X-ray appearances precede clinical features cannot be a correct one, because first there will be some clinical features, then the X-ray changes will come. Or another important point is in kerosene or petroleum distillate poison, petroleum products, gastric lavage is not commonly recommended. Not recommended or used because it possibly produce aspiration complication. Aspiration complications. So first line, induction of emesis predisposes to pneumonitis. So that's why gastric lavage and emesis not to be induced. Fever occurs in initial few hours. Steroids are helpful to control those inflammations. It's more of a life saving. Okay, 195, choice B. The next question, 196. It's more of a biochemistry question. So which are the enzymes found in CSF? So CK, LDS, lactose dehydrogenase. So that is more of a slightly overlap question. So maybe useful for certain like postmortem interval studies and sort of estimation for time, but not very common from forensic point of view. Then 197. Spaulding sign is a radiological finding, X-ray finding of a dead bone fetus overlapping of skull bones. So when taken erect position, X-ray of the mother, then due to the shrinkage of the brain, the the bone skull bones may overlap. Yes, there is no fusion of the structures. So there is more of a sign of dead bone, which is basically related to maceration. Another radiological finding is something like one is Spaulding sign, then one is the Roberts sign. This is gas shadow, the blood vessels. So these are some of the radiological findings. One is the Spaulding skull bones, one is the blood vessels, big vessels. 197. Related to maceration or what you call intra-uterine. 196. There is again a repeat question. Already we have an image question on that. 198 is a question on scales. Already I have briefly discussed by liquid or moist heat like steam. So I already said more amount of blister formation, less amount of tissue destruction. So that is 198. 191, that's an image question again, picture. That is a popular postmortem word tachynoir, which is drying and desiccation of the sclera conjunctiva on both sides of the iris. So that is postmortem finding. Tachynoir, observe when the eyelids are kept open. So eyelids are kept open and there is a gradual drying desiccation on the cornea conjunctiva leading to these two triangular formations. So answer, PM finding of that. And last question, question number 200. There's a table that we normally have in our sort of textbooks, differentiate between the human and animal here. Here study normally known as trichology. Human obviously texture is fine. This one not that fine. Then the scale, small, flattened skin, large scales, cortex, thick, 4 to 10 times of medulla, thinner cortex. Then the most important point is about medulla. Medulla thin, sometimes absent, sometimes fragmented, means discontinuous. That's the one. But in case of animal, medulla is thick, always continuous. So absent medulla, this is feature of human. So that is question number 200. That's all. That explains about 100 questions in this subject-wise test of